All right, guys, we have a great show today. I want to thank you for joining me today in my Poop Scoop Monday. We have a lot of things we're going to talk about. We'll discuss how you get older. You can have changes in your metabolism, how things slow down, and what you can do to get that taken care of you. We'll discuss hemorrhoids. What can you do to get those taken care of and get those resolved? We'll give you tips on preventing hemorrhoids and anal fissures. We'll talk about food sensitivities versus food intolerances versus food allergies. What is the difference and what is going on? And we'll do a deep dive on the topic non-typical symptoms of reflux. So you may be wondering, do I have acid reflux? What is going on? Why am I constantly clearing my throat? These questions and your questions live on today's Poop Scoop Monday. I want to thank you for watching. If you're joining for the first time, my name is Dr. Islam. Yes, I am your poop guru. My passion is to give you the truth, the real information about what is going on in your health. Every Monday, I go live on my social media streams to answer your questions you guys may have. If you haven't already, don't forget to smash that like button, like, share, and subscribe. Let me know where you guys are watching at, and also let me know if you're watching this live or on the replay. I have a goal today. Our record is getting over 50 likes. I want to see if we can beat that on today's Poop Tip Monday. So look forward to seeing you guys. Put your questions down below as well. And also let me know what you guys think about my audio and my video and trying a new system out. So let me know how it works as well. How was y'all's weekend? Oh my goodness, my weekend was great. Football. Oh my gosh, my Longhorns. Holy moly. I cannot believe we almost lost to Houston. Listen, I know you guys are from Lubbock. I know you guys are Tech fans. But listen, being a UT fan, it is hard for my heart. It is terrible seeing our team, which has so many 5-star recruits, not being able to get stuff done. Oh my gosh. I almost had a heart attack. It killed me. I'm also excited about baseball. The Rangers pulled it off last night. And tonight, if I'm not mistaken, I think we have the last game. So I'm excited to watch the game. Let me know in the comments down below. Are you a Rangers fan? Are you an Astros fan? Who are you hoping is going to win tonight to get into the World Series? I'm excited. I don't have a dog in the fight, so I really don't care as long as a Texas team gets in. So I'm excited about that as well. I finished a couple of books over the week. I finished the Elon Musk book. I don't know if you guys got a chance to read this or look at this. Walter Isaacson. It is a great book. Let me tell you, the moral of this story is that Elon Musk is a complicated character, and I don't want to be a billionaire. His life does not sound like fun. Every single day, it is drama. It is stress. It is things that you have to deal with, and it does not look like a fun job at all. It doesn't matter if you're the world's richest man. If your life is terrible, you have a lot of insomnia issues, you have stress to the point of vomiting and having diarrhea, you don't enjoy your life, you lose your friends, no one likes you, that is not worth it. So it's a great lesson on maybe what not to do. Let me know in the comments down below if you have any book recommendations. I try to read a new book every week as well. All right. Lastly, a couple of other updates. Do you guys have any plans for Halloween? I know in Lubbock Gastro, we're doing a trunk or treat for our community. So we're gonna have treats, and I'm gonna have a couple of surprises. I'll be there dressed up in a costume. Let me know in the comments down below what costume you guys want me to talk about. All right, let's go and start. So topic number 1: what happens when you had? Sorry, let me start over again, all right? So our first topic, hey, Dr. Islam, I have noticed that my digestion has changed as I got older. What is going on? So let me know in the comments down below if you've noticed you've had to change your digestion as you gotten older. I know that as I've gotten older, as I'm getting into my 40s and later on, I've noticed my gut has changed as well. It's a very common problem to occur. So what is occurring? So as we get older, a lot of things change in our body. You know this, I know this, and one of the things that does change is how your gut is. Things slow down as you get older. You have changes in the peristalsis of your gut. You have changes in the movement of your gut. You have changes in how things get metabolized, broken down, and digested as well. And so those changes over time can lead to a variety of GI conditions. In the upper GI tract, bloating, heartburn, reflux. You can also have in the lower GI tract constipation, maybe even diarrhea. Sometimes you can have hemorrhoids. You have abdominal pain because of the change in the motility and the movement of your gut and your GI tract as well. And this is very common to occur, and it can also affect how you digest and how things can go. But don't be worried, because there are some solutions that you can do to help out with the motility of your GI tract. Let's talk about them. So first thing you need to do is movement. Your body thrives on movement. And as we get older, as things slow down and things don't want to progress, movement, physically getting up and getting out, allows you to help you to propagate and move things through. Do what you can to go outside. Today it was raining. Guess what? I was outside because I need that movement to help me move things along, because as I get older, I've noticed that things are not moving as effectively as what we want. That's recommendation number 1. Number 2, find ways to get younger. What do I mean by that? Your gut microbiome is the fountain of youth. And so the younger your gut microbiome is, the younger your GI tract is going to be. Did you know the fountain of youth is right in your gut? So find ways to make your gut younger, and the best way to do that is to give it the nutrients it needs to replenish and give you good bacteria. By far, the most effective thing you can do is to have a plant-based diet. This will feed the good guys, change your gut microbiome to make it normal, make it younger, and make it better as well. So find ways to make your gut younger, and the best thing that you can do is to change what you're eating and what you're putting into your mouth. And then lastly, try to find pro-motility foods to help you get you going and flowing. Things like kiwis, prunes, plums, ripe bananas. These actually have natural digestive enzymes to allow things to flow through easier, more consistently, and to give you better bowel habits as well. So these are things that we can do as we get older, because it's natural as we get, we want to get older, but things will slow down. But these are ways that we can do to minimize that and hopefully allow things to get better. Let me know in the comments down below if you have any other recommendation you have tried to help out when it comes to motility and movement of your GI tract when you get older as well. All right, if you're joining for the first time, my name is Dr. Islam. Yes, I'm your poop guru. Every Monday, I go live on my social media streams, answer your questions you guys have. If you haven't already, don't forget to smash that like button, like, share, and subscribe. Let me know in the comments if you have a question, if you're watching this live or on the replay, and also let me know where you guys are watching this at as well. I am hoping to get over 50 likes on today. That is a record, so smash that like button and can see us a little bit gouger for all your GI needs. All right, we have a question on here. Let's see, I saw a question on here. So Loretta, thank you for watching. Tevin, thank you for watching. Raymond, thank you for watching from Idaho. So far, you're the winner for the furthest so far. Tevin asks, EOE, what is it and how do we treat it? Great question. So EOE stands for eosinophilic esophagitis. This is where you have a lot of algae cells inside the esophagus. In fact, I had a patient today who came to see me because they had a diagnosis of EOE. They wanted me to find out what's going on. So how do we diagnose somebody with it? Well, first we have to have the clinical suspicion that you have EOE. So things that can cause, or symptoms that can mimic EOE, include heartburn, pain in this area, difficulty swallowing, painful swallowing. This will allow us to make us suspect you have this condition called EOE, or eosinophilic esophagitis. So next, we need to confirm that you have this diagnosis. How do we do this? We actually do what's called an upper endoscopy, or an EGD, where I go down inside the upper GI tract and I look at the esophagus and see exactly what is going on. And I take biopsies of that esophagus so I can determine, do you have EOE or not? And we actually look underneath the mucosa in the cells to see, do you have a lot of what are called eosinophils, which are allergic cells in the esophagus. If you have a lot of them, that confirms that you have that, then we can talk about treatment. And for some patients, we can do dietary changes, avoiding meat, avoiding dairy, avoiding oats, or we can put you on actual medical therapy to decrease the inflammation going on. And so when I suspect somebody has this, I would look at the symptoms and I take a look with the scope to confirm if that's the case. Let me know in the comments down below if you've been diagnosed with EOE, or if you have a question about this condition, which I can do a long form video on this as well. Great question. Loretta, hook 'em horns. Thank you. Debbie, thank you for watching as well. Brandon, thank you for watching as well. Vicky, thank you for watching from Jersey. So Jersey so far, I think you're the winner. So thank you for watching. Diane, thank you for watching. Christina, thank you for watching as well. And Jerome, thank you for watching. I thank you, and I appreciate you watching the videos. Perfect. All right. So let us go into another question. So Christina, great question. I love this. Your friend got a poop sand timer. Is there any benefit for this? So let me know in the comments down below if you've gotten a gift like this. I love this question because this is a real thing that I would love to have my patients do. Let me know, Christine, if you can send me the link for that or what your friend got, I would appreciate that. So does timing your poop actually matter? That's the real gist of this question. The answer is yes, it does, because you can sit on the toilet too long, and that can cause a lot of issues. You need to train your butt. Yes, you do. Training your butt is what you need to do. And this is a common reason why a lot of people have constipation, hemorrhoids, fissures, because they're sitting on the toilet for way too long. When you sit on the commode and you don't go, the answer is not to sit longer. The answer is to get up and move around and don't use the restroom. And that's okay. Sitting on the toilet for a long time trains your colon to be okay, just to chill out and take its time to use the restroom. That is not what you want to do. You want to have consistency. You want to have regularity, and you want to make sure that your body it thrives on doing things on a consistent basis. It needs that. And so what I tell my patients is that if you're sitting on the toilet for more than 2 minutes, get out. Don't sit on there any longer. If you're not using the restroom, sitting longer is not going to help, because all that's going to do is going to reinforce your body that it can just take its time while you're trying to take a dump. And that's not what you want, because that will lead to longer issues down the road. So stay on the toilet, use a timer, don't take your phone in there because it makes things worse. And if you're in the toilet for longer than 2 minutes, that means you may need to get up, because your body thrives on rhythm and you need to have the consistent time, a consistent pattern, so your body can help you use the restroom a lot easier. It's a great question. I love this question. Let me know in the comments down below if you've tried a poop timer or anything like that to help out when it comes to your bowel habits. Great question. I love that. All right. Tevin, you're going for the Astros. All right. Shirley, thank you for watching from South Carolina as well. All right. So if you're joining for the first time, my name is Dr. Islam. Every Monday, I go live on my social media streams. If you haven't already, don't forget to smash that like button, like, share, and subscribe. And come see us Lubbock Gastro for all your GI needs. Or if you can't see me, watch my videos. I have a lot of good information on there as well. All right, question number 2. Hey, Dr. Islam, I don't want to get hemorrhoids. What are some tips that I can do to prevent hemorrhoids and fissures? So I'm going to give you 3 tips I recommend for everyone so you don't develop hemorrhoids. Number one is to make sure you increase the fiber in your diet. Fiber is a foundation for gut health, but not only can fiber help out with your gut, it can help out with hemorrhoids as well. It makes stools softer, slicker, easier to pass through. And there's nothing a GI doctor likes more than having slick bowel movements. I know I said it, but it's true, because the easier it is to pass, the easier it's going to be for you to have a bowel movement, and the less likely you're going to have hemorrhoids. So tip number 1, add fiber to your diet. Tip number 2, make sure you have enough hydration. Now, a lot of us can do this, and that's okay. It's not something that's too hard to do, but being dehydrated certainly can make things more difficult when it comes to bowel issues, because the less water that you have, the harder your stools are going to be, the more difficult it's going to be for you to pass a bowel movement as well. So make sure you have enough hydration to allow you to hopefully have smooth bowel movements, to give you adequate flow and help you out when it comes to issues down below. All right. Number 3, develop good bathroom habits. I don't sit in the toilet for a long time, no more than 2 minutes. Don't bring your phone into the bathroom as well, because the more likely you have the phone, the more likely it's going to be for you to sit on in the toilet and use the restroom. Use something to elevate your legs, and don't sit on the pot for a long time. Now, if you've done all this and you still have hemorrhoid issues, well, guess what? I can fix those. It takes about 10 seconds. It's quick, it's easy, and it's painless. We do what's called hemorrhoid banding, where it sounds weird when you put a rubber band around the hemorrhoid. You feel a little bit of pressure or the urge to poop, but then it goes away and fixes your hemorrhoids typically for the rest of your life. So if you've done everything right, you're still having hemorrhoid issues, come see us a little bit gastro. We can find out what's going on and get them fixed. But if you try these things, this should help out as well. Let me know in the comments down below if you've done these tips and have they worked, or do you have any other tips for my audience when it comes to hemorrhoid issues, because we can find out what's going on and get them taken care of for you as well. All right, if you're joining for the first time, my name is Dr. Islam, and yes, I am your poop guru. My passion is to give you correct information that's not based on social media or anything else that's out there that's not based on research. If you haven't already, don't forget to smash that like button, like, share, and subscribe. I'm trying to get to 50 likes, guys. I only got 15. You need to push more likes. And if you don't forget to come see us at Gastro for all your GI needs as well. All right, next topic. What is the difference? Next topic, what is the difference between food allergies and food sensitivities? This is a very common question that I get. So let's talk about this. What exactly is a food allergy? A food allergy is when you have an actual allergic response that's been diagnosed and tested. And you can actually do this with an allergist, in which they can actually check you for food allergies to see if you have this. And if you eat these foods, it will lead to a systemic or body response. Things like hives, difficulty breathing, wheezing, your neck gets closed off. And these are very serious conditions. Common food allergies include nut allergies, shellfish, or even shrimp. I have a shrimp allergy. If I have shrimp, my face breaks out in blotches, and I have to itch everywhere. I have to take Benadryl for this. This is the true food allergy. Now, food allergies can only be diagnosed by an allergist by certain testing, whether it's blood testing or skin prick testing to see what foods you are allergic to. But the important thing about a food allergy is that it is life-threatening, it's dangerous, and these are individuals who may need to carry an EpiPen to make sure they don't have a systemic reaction for what is going on. This is different from a food intolerance. These are foods that lead to manifestations of GI symptoms, bloating, distension, diarrhea. These are not life-threatening. They're annoying, but they're not life-threatening. And there's no real good way to test this except for what's called a food diary or a food elimination test. Meaning, and this is the important thing about this, you cannot test a food intolerance with a blood test. You cannot test a food intolerance with a skin test. You cannot order a food intolerance test to find out what is going on because they're not accurate, they're not sensitive, and they don't work. And for a lot of my patients, they go through all this testing for food intolerances. They get these tests that they spend thousands of dollars on, they get them online, and they come to realize it was basically a waste of money. Two ways to diagnose this. One is sometimes with an upper scope, we can use certain testing to see if you have any intolerances to certain foods, one way. Or number two, the best way is your body's response. Whether it's a food diary, a food journal, or a food elimination diet, this is the best way to do that. The most common foods that people have an intolerance to include gluten, lactate or dairy, artificial sweeteners, or other carbohydrates. And the best way to know this is to avoid these foods and seeing how you feel. It is cheaper and easier for this. And the important thing about a food intolerance is that it's not life-threatening. It is annoying, but not life-threatening as well. So the important distinction between a food allergy, which is life-threatening, versus a food intolerance, which is not, but there are different ways to diagnose this and treat this as well. Let me know in the comments down below if you have a question about food allergies or food intolerances and what the difference is and how we can clarify what exactly is going on there as well. Perfect. All right, guys. Thank you guys for watching today. So we have another question. We have another question here. Debbie asks, why does SIBO cause diarrhea? So let me know in the comments down below if you know what SIBO is. But SIBO is small intestinal bacterial overgrowth, or the SIBO. And what this basically is an overgrowth of bad bacteria. Constantly in our body, there is a fight between good bacteria and bad bacteria. And sometimes the bad bacteria can overwhelm the good guys to cause manifestations of different symptoms, including bloating, distension, and diarrhea. And when you have too many bad bacteria, that is called SIBO, small intestinal bacterial overgrowth. And one of the more common symptoms is diarrhea. And there are a lot of reasons why. It can be due to sometimes the deconjugation or changing of the gut microbiome and the inability to absorb certain nutrients and vitamins that can lead to the diarrhea symptom to occur as well. And this is why for a lot of our patients who've been diagnosed with IBS or irritable bowel syndrome, there's been studies to suggest that 20% of them actually have an underlying SIBO as the cause for their symptoms. So how do we diagnose this? 3 main ways. We can do an upper scope and get fluid from your small intestine and see what's going on. Way number 2 is that we can do what's called a breath test. We actually measure the bacteria in your small intestine. Or number 3, we can do an empirical trial of an antibiotic therapy that treats SIBO and seeing how you do. All 3 tests are very reasonable approaches for us to diagnose and treat patients, and we treat SIBO by multiple different ways, whether it's medical therapy, whether it's anti-herbal therapy, whether it's dietary therapy, or whether it's a combination of the above. And so if you're wondering if you have SIBO, this condition, can see a level gastro where we can diagnose what is going on. Let me know in the comments down below if you've been diagnosed with SIBO, if you have treatment for SIBO, what has worked, what hasn't worked as well. All right, perfect. So Jerome asks, are there any fiber products that I recommend to promote better health? I love that. That's a great question. There are certain fiber products that I do recommend. Number 1, I have found that for a lot of my patients, taking fiber supplements actually works out good. So don't do fiber gummies because they don't have enough fiber. But fiber supplements like Benefiber or Citrusil, in my opinion, tend to have the best bang for the buck because you don't have a lot of the side effects that occur by taking other fibers like bloating and distension, but you get the benefit from that. Obviously, fibrous foods are fantastic, but see how you do with that, because some patients don't have a good response to having fibrous foods, and that can make their GI symptoms worse as well. Great question as well. All right. Last topic here before we go into their last topic. We're at 31 likes, guys. Give me 20 more likes. Come on. We can beat 50. We can do it. Get me there. It'll make me a happy poop guru. Our goal is to get over 50. Let's see if we can get there for that. All right. Last question. Hey, Dr. Islam. I think I have GERD, but I don't have the typical symptoms of heartburn or regurgitation. Do I have GERD? So let me tell you that a lot of my patients have what's called silent GERD, or they have non-typical GERD symptoms. And you actually may be suffering from this as well. Do you suffer from throat clearing? Do you suffer from a chronic cough? Do you suffer from voice changes? Do you suffer from nausea, indigestion? Maybe you have non-cardiac chest pain. If you suffer from any of these symptoms, actually hold on one quick second. Let me, my camera turned off, so give me one quick second here. All right, I'm back on. Sorry about that. So once again, if you suffer from any of these non-typical GERD symptoms, you actually you actually may be having GERD as the cause for your symptoms. And so GERD is just not heartburn or regurgitation. It can cause a plethora of other symptoms, the ones that I mentioned before, but things like asthma, nausea, belching, bloating. These are all non-typical symptoms of GERD or acid reflux. So how do we diagnose this? So number 1, we can try and put you on a trial of an acid medication, see how you clinically do, and see your clinical response to that. If you respond to that, that clinches the diagnosis that you have GERD. Number 2, we can do what's called an upper endoscopy or an EGD to see if you have damage in the esophagus from that. So if you have chronic cough and see damage in the esophagus from reflux, I can tell you have chronic cough that is due to acid reflux. That gives you that information as well. Or number 3, we can do what's called pH testing, where we can actually measure the amount of acid going up into the esophagus, and that determines if you have acid reflux or not. So if you have symptoms like belching, bloating, throat clearing, feeling like there's a frog in your throat, asthma, symptoms like that, and you're wondering if you're having GERD, come see us at Gasha. We can find out exactly what's going on, get things taken care of, and hopefully resolve the issues as well. All right, I'm done because the game is on. I'm going to watch it. Well, thank you for watching today. If you haven't already, don't forget to smash that like button, like, share, and subscribe. And if you have GI issues, come see us at Gasha. We will love to take care of you, find out what's going on, and get you all scared away. Hope you guys have a great day. See you guys next Monday. Tune in, show your friends, have them come join us. Let's see if we can beat 35 likes next week. Thank you for watching. I appreciate you guys. I love you guys. See you guys next Monday. Have a great day. Thanks, everybody.